nice to be back here in New York City, where I spent many years teaching worker education at the City College's then Center for Worker Education. I'm now at UC Berkeley, where I'm a fellow in the geography department. Yesterday I was quite honored, I think, to be able to talk about an old friend and comrade of mine and teacher, Edward Thompson. Some of you may have heard of him, best known for his book, The Making of the English Working Class, which in many ways was an appeal for the kind of things that we're interested in here. Thinking about the talk, and trying to say, well, what could I very briefly say about it? It seemed to me that above all, he championed things like agency, by which I think he meant self-activity, choice, the idea that human beings have choices to make, that their activities are not determined, predetermined, and values, that values are important in terms of, for him, a socialist movement, which he tried to trace back to the earliest days of British socialism. But agency, choice, and values, I think, were ideas that I thought about. So I just want to make 2 points today. And start off by saying it's always a great honor for me to be amongst healthcare workers, a greater honor to be amongst union healthcare workers, and an even greater honor to be amongst the people like yourselves who are really on the front lines, working in the trenches of the movement today. I'm sorry that Judy isn't here, but I imagine that's because she's madly working to get the new revitalized NYSNA ready for a possible strike of, what, 18,000 healthcare workers in the city? So we can forgive her, can't we? Anyway, so my 2 points and thoughts from someone really who's on the outside of this. I think that the things that have been on my mind first, that in today's circumstances, we really need to speak up for the rights of workers to have unions. But we also need to speak up for the rights of workers to have unions of their choice, which seems to me to be one of the really major issues that we face in California. And secondly, it seems to me that when we're working and thinking about unions, we have to ask ourselves, not just do we need unions, but what kind of unions do we want? What kind of unions do we need? I think, in my own experience, working especially with the National Union of Healthcare Workers, that it's to their credit that they've been willing to offer us a model of what a union can be, and a model not really from the 1910s or not from the 1930s, but a model in the here and now. So I think we need to think about this model and talk about it, debate it, let people know that it's out there. I think that's very important for all of us, especially those of us who have the time to do that. It seems to me that it's a good model. It's the kind of union, I think, that my mentor, Thompson, liked. A union model that involves worker leadership, that is agency, self-activity, that's democratic, that fights for its members, that practices solidarity, that's not, sort of a version of what, Monopoly or the draft in baseball or something, you know, where, that practices solidarity, that's progressive, that's not afraid to talk about the hard realities of our lives. So that's all I have to say, really, that it seems to me that we have living examples now of agency in practice, self-activity in practice, and of a union with values, unions with values, and not just the NUHW, obviously. There are people here from other unions as well. And unions where choice is put out front, where people have choices, you know, over in the bigger picture to be union members, in the union picture to have not just a union, but a decent union, a union of their choice, a union that fights for them. Now I have some very long resumes in front of me because we have some very accomplished speakers here today, and it's again an honor for me to be here with them. I'll just go down this way. And do you want to speak in that order, or maybe we should?
It's going to be Elizabeth.
Sorry?
Elizabeth.
You guys made up your own mind. Okay, who's first?
If for the NUHW piece, I would go first.
Okay. And you want to go second? You want to go third?
Sure.
All right. So, Clem Papazian is a licensed social worker for Kaiser in Oakland. He's worked there for a long time and knows a lot about what is going on. Oh,
Judy,
I should be late.
Judy. I just made excuses for you.
Oh, yeah, well, you deserve it. It's been hell.
You had a pass. Anyway, Clem is he's a specialist in psychiatric emergency and crisis intervention. As I said, works in Oakland, and he's been for 15 years a labor leader. He's an elected officer of the National Union of Healthcare Workers, and you're on the executive board.
As well, yeah.
And a president of your unit. And next, Elizabeth White is a psychotherapist and a clinical social worker who, again, has a long resume and a long history of working in the Bay Area. She's been in Los Angeles. She's been a community educator, a social worker, an administrator, a healthcare labor leader. She works as a psychiatric social worker for the largest, as we all know, healthcare maintenance company in the country, good old Kaiser Permanente, which is best known for paying its, how much does the new president, the new CEO get? 9 million? 27 pensions?
Yeah, not the 3.6 million of New York, the 9 million of California.
Anyway, she works there, and she's a bilingual speaker. And she credits, I'm curious about this because I'm one of these people that, as a kid, I lived in the Midwest for a long time and went to school in the Midwest, but now all I do is fly over it. But she says she credits her Midwestern upbringing for her values and her dedications. And next we have Judy Sheridan Gonzalez, and thank you very much for all of us for taking time from your very busy schedule. Judy is the president. She's a registered nurse, and she's the working president of NYSNA. How many members? Many.
37,000.
37,000 members. She helped lead the transformation of NYSNA to a fighting union that's really stand up for nurses, and as part of that is now involved in a possible strike of 18,000 workers here in the city. Thanks again for joining us. And finally, Dana Simon has come down from Boston, and he is the Director of Strategic Campaigns for the Massachusetts Nurses Association. He has a long history of work in the labor movement, going back to working for Local 250 in Oakland, which is the predecessor of NUHW. He, I've been leading up to the history there. And he worked also in Boston for 1199 SEIU and for Unite here, and is deeply knowledgeable about the issues of labor and the problems that we face today. So you guys choose your order. I think the audience will remember who you are. You can come up here to the podium if you want, and I'll get out of your way.
Okay, sure.
Are you going first?
Yeah. Yeah.
Elizabeth White.
All right, thanks. Okay, hello friends, brothers and sisters, we're a small group. But I wanted to talk with you first about two things. First about the NUHW, the National Union of Healthcare Workers, and then I wanted to talk to you about how it's a model union, and then how my experience inside that experience looked. So before I begin, a little background on the National Union of Healthcare Workers. It was founded in 2009 with fewer than 1,000 members. The union started by former leaders of the SEIU's local healthcare union called United Healthcare Workers West. This local union in California had a progressive history and essentially decided to form a new union with different principles that we would now see as the model union. So NUHW now has grown to over 10,000 union members representing healthcare workers in a variety of healthcare settings, nursing homes, hospitals, health clinics, and most recently in prison healthcare systems, as well as my employer, Kaiser Permanente, the giant of giants in the healthcare industry. Folks have to understand that Kaiser Permanente is as large as Verizon Communications. It has a $54 billion revenue. This is a giant of giants. Today, I want to talk first about what a model union looks like, and then how I am active inside that model union. So one of the things that I think it starts with is commitments and values. Our little brochure called What is a Union talks about that. We have a constitution, and as a leader, I spent time looking over the constitution, looking over what our values and commitments are, and that's modeled in our experience every day with other members. Because if you lose those values and commitments, you lose your strength. We also have become, in a model union, militant. You must stand up, you must be a fighter, and you must be strong. We're up against the giants of giants, and you have no choice. And as one of the signs on our strike line showed that got national attention, there was a strike picket sign that said, David versus Goliath. That is our fight. We're worker-led. I am a full-time psychiatric social worker, and I do more than that. We are also part of a movement. And I think, my background as a Spanish-speaking therapist, our opportunities to liaison with Occupy. And remember, the patients that I see in my office, many of them came into the fact that they have a Kaiser Permanente insurance because they're unionized workers. They were unionized in the 80s and in the 90s in Los Angeles under SEIU, under Unite here. And that makes a difference in your work because you're working alongside them, you're serving them as their therapist. So it's part of a movement, it's democratic. As our Constitution talks about, we have member rights. And we have to take on compelling human rights issues. The human rights issues we've took on is mental health. And of course, we have to have a voice in the workplace because members need to feel that they're part of a living union right there at the very workplace. So what a model union does is it organizes new workers, it bargains strong contracts, it maintains raises, maintains standards in the area of concessions. It advocates for quality patient care and safe working conditions. It gives a voice at the local worksite. It stands up to other unions that weaken our progressive labor movement. And we commit to enthusiasm, courage, and solidarity. So I mentioned before commitment and values. I can't really say enough about that because, again, you have to keep questioning yourself. Where am I going with this? How do I comport myself with my fellow union members so that they sign on to the cause? In a model union, we also are well prepared and organized to fight. We give hope to people that we can win and strike if we need to. We hold governmental regulatory agencies accountable. We hold decision makers accountable, local elected leaders. We organize one-day strikes, two-day strikes, the short strike concept. We file unfair labor practices, and we have numerous wins in that area. We increase the number of stewards and those willing to take the oath of leadership, and we collect voluntary dues. And for the 4 or 5 year contract struggle we've had, we've been able to keep 50% of our members paying dues. And that's $94 a month. So again, you know, when you pay money, just like when you tithe, you make a commitment. Our union has democracy in it through the rights of members. A model union works to make healthcare a human right, and union members are encouraged to join in the struggle for universal health care coverage. But our union members have the right to elect leaders, put meaningful issues on the table, and many times in my local worksite, we would ask ourselves, do we fight on or do we take the concessions that Kaiser's offering? Do we fight on? We have to ask ourselves. Because if you ask yourself and you commit to fight on, you feel the strength. We have workplace organization, we have a steward structure that knows and enforces the contract. We educate, organize, agitate. We prepare for actions through leaflets, petitions, vigils, informational picketing, and of course strikes. We have training and development through annual conferences, our newsletters, books, and publications. Thank you to Cal, who's also written about our union. We go to conferences such as Labor Notes. We also have an outstanding research department that really helped us in our campaign for mental health parity. We've also reached out across and created coalitions and advocacy, and we have much, much more work to do. We work with the Courage Campaign, which is a progressive group in California with a 900,000 email list. Most recently, we've been working with the group that represents the consumers and the parents of individuals affected with mental illness called the National Alliance of the Mentally Ill, NAMI, and we hope to build more coalitions. And of course, we work with new organizing. No group is too small to have a potential union members, and we've had great success working along the California Nurses Association in the north with some small hospitals, but the largest employer in the most northern county of California called Humboldt County, where they've won contracts and improvements. We have other, of course, in these days, you have to have an outstanding communications avenue, media, the NUHW.org website. We have NUHW News, terrific support for our strike, which Clem's going to talk about. Just the framework of getting the press release out there created an amazing buzz and a great success for getting national and even international attention for our 5-day strike in January. We also, of course, reach out across the aisle to politicians, interviewing them and giving to those people that support our principles, universal health care, and other causes. We also have transparency in our operations and our finance. We also, as a model union, stand up to other unions. And in the Kaiser Permanente system, this is a heavily unionized employer. There's a long history because Kaiser would have never existed if it wasn't for unions. And that's part of the backstory of Kaiser. So 70% of the workforce is unionized. Unfortunately, much of the workforce of Kaiser, however, is what we call the company union. So the SEIU is the dominant holder of this coalition of unions. And unfortunately, they do not allow workers to really speak up and to own what's happening to them. Because remember, Kaiser Permanente is a success story. This is a $54 billion revenue company. Workers deserve to have more than just a cost of living increase. And they also deserve not to be charged 9 cents an hour for something called the partnership tax that we've discussed, uncovered. Because why should workers be taxed to partner with the employer? So just a few comments about myself and my own personal transformation as a leader in this union is that we learned to fight. Thus, we became militant. There is no other choice. We have to own our narrative, not Kaiser's narrative, not other unions' narrative, our narrative. And we have to tell our story over and over again in a coherent way so members can get motivated. And that's what we did on the strike line. We told our story to the press, we repeated what we told it one more time, and that's why we were able to get, essentially, take a stake in our issue around mental health services. And as we know, mental health has been such a great concern for many, many workers because they're under stress in the new economy. So we didn't buy into Kaiser's turbulent times and the recession. We owned our own narrative. We understood the significance of our fight. We weren't just fighting for ourselves, for our patients, but we realized that we were fighting for other workers because those workers are our patients. And when those workers go to the table to bargain, have their leaders go to the table and bargain for an increase in a wage, their employer comes back and says, oh, Kaiser Permanente, the healthcare company, raised the premium. I can't give you that raise. So we put this story together, and we knew that this age of austerity that we heard about was affecting not only us, but other industries. And of course, at a conference like this, you realize it's a global problem. Industries like Boeing, Caterpillar, and Verizon were also preaching austerity. So we learned to educate, organize, agitate, and repeat. So through open and rigorous debate, we earned the respect and loyalty of our union members, thus gaining solidarity at the workplace. We learned what it means to help workers understand who they have to sign, what side are you on? And just to give you an aside, 2 workers that just joined my department, 2 Latino workers, they weren't even past probation. They've been on the job 1 or 2 weeks, and they're out on the picket line with us. Because they understood, because they grew up in Los Angeles, they understand what it means to stand up for themselves and patient rights. So we built on and expanded our steward structure. We gave every steward in our organization the legal rights of stewards with our logo proudly displayed. And another component of a model union, it seizes a human rights issue that's compelling. And our issue is mental health parity that Clem's going to talk about in detail. Patients that have a mental health disorder were never treated the same way. But depression, anxiety, I'm telling you, is a very impairing diagnosis. And it needs to be treated the same way any other healthcare problem is. So we finally were able, through a variety of, continue to stand up and continue to fight for these principles for my fellow union members, for our children who will inherit our republic, for myself, because we want workers' voices to matter in this new economic order that we face in our world today. Thank you for the opportunity to speak to you.
So for those of you who just came in, that was Elizabeth White from Los Angeles, NUHW, and our next speaker is Clem Papazian from the NUHW in Oakland.
Thanks, Cal, for that warm welcome, and it's a pleasure to be talking to you here at Left Forum. I just want to say that, I'm first and foremost a clinician. I'm relatively, I came to the labor movement some probably year 2000. And I'd like to open my comments this morning by sharing some closing comments I made during a 5-day strike of 3,000 mental health workers at 200 sites throughout the state in January. These comments were made in front of the executive leadership offices of Kaiser Permanente, a multi-billion-dollar nonprofit healthcare organization that for the last 4 years workers have been struggling with in a labor dispute over its obligation to provide adequate staffing and timely services for mental health patients. Quote, "Some people thought we would never be strong enough to decertify from SEIU, and we did it. Some people thought we would never sort through the complexity of the mental health service model in order to mount a convincing argument to the state about the seriousness of the problems in mental health care at Kaiser, and we did that. Some people thought we could never find enough agreement in our ranks to authorize a one-day strike of our mental health workers, and we did. Some people thought we could never get everyone to agree to an escalated 5-day action, and we did that too in truly remarkable fashion. Some people thought that nobody would ever pay attention to a small unit of mental health workers at Kaiser, but as a result of your action this week, now 800 media outlets throughout the country have covered this strike. Kaiser, the whole world is watching," unquote. Now, I want to try and deconstruct for you the tactics of a strategic contract campaign that over the last 4 years led me to make those rally comments. In doing so, I hope to share a story about how we forged several thousand mental health professionals into formidable activists who are fighting back against one of the most powerful healthcare corporations in the country, currently enjoying record profits to do the right thing. Mental health professionals at Kaiser unionized for the first time in 2000. Initially, we were represented by a small union and were eventually forced into SEIU UHW without a vote. When this transition occurred, there was great skepticism among our members because we were professionals and we were unsure of the kind of representation we would receive because we were the first professional classification to be represented by UHW. For years after we first became represented, we attempted to work within Kaiser to create a reasonable staffing plan to serve the mental health needs of Kaiser members, and for decades we were ignored. And let me tell you, friends, for the people who do this work as a calling to help alleviate the suffering of others through reflection, nuance, patient uncovering, the mill-like nature of these clinics became a viscerally painful experience for these workers. In 2008, following a schism of epic proportions centered around the core philosophy of trade unionism, is a union the voice of the worker members or merely the voice of the professional union? UHW split from SEIU and became NUHW, with its central feature being its commitment to the voice of workers. All of these providers were extremely aware that the employer knew there were serious shortfalls, but persisted in not only dragging its feet in implementing any substantive staffing changes, but appeared to be using understaffing as a calculated labor strategy aimed at saving millions in costs and putting it back into the pockets of its executives. Cost savings based on chronic understaffing became the dirty little secret among mental health professionals at Kaiser, who euphemistically termed it rapid access to no care. We came to realize that Kaiser really didn't staff their psychiatry departments with enough psychologists, therapists, and social workers to handle the demand for services. There simply are not enough of us to provide timely, adequate care for the number of patients seeking our care. Care that patients pay for, that Kaiser is required by law to provide in a timely manner. Our patients can't get appointments because our schedules are already booked solid, and the caseloads grow rapidly, quickly becoming unsustainable as Kaiser continues to enroll hundreds of thousands of new members under the Affordable Care Act. While these professionals knew intuitively what they needed, they often lacked focus and organization to present a salient case to the boss. For years, they attempted to work within the system under the auspices of the highly touted Labor and Management Partnership at Kaiser, whose very mission statement prescribes active collaboration with frontline workers as its primary guide in drafting, staffing, and care delivery services. When it became clear that these principles were nothing more than hollow words, our mental health professionals lost faith in the aspirations of the LMP and decided to use the strength of their union to create change. And in a gift of symbiosis, NUHW, born out of a struggle of philosophy, meets Kaiser mental health workers enraged, ignored, and ready for change. Because workers don't come to the table as activists, they needed to be developed. They needed help in drafting cogent strategy and building systems of organization to find the path forward. A strong union and community of unions committed to facilitating the voice of members drives energy and momentum. Like any mentoring relationship, the distinction between complete usurpation, the union simply taking over because they know best, versus support, the union listening carefully, making suggestions and recommendations based on close collaboration, is key. NUHW's values married perfectly with how these workers function in their professional lives. They listened carefully, shared ideas, were accountable, and made recommendations solidly based in the needs of workers. At the same time, they consistently helped build forums of inclusion and organizational structures that encourage the integrated voice of members in pursuit of advocacy goals. The feedback loop generated by this commitment to process is, in my opinion, the part of what it takes to build a model union. In Northern California, for example, we developed a deep roster of stewards that met monthly for all-day discussions aimed at maintaining the continuity of shared goals and gave voice to dissenting opinion. We have regular regional and statewide conference calls to move forward key initiatives, to maintain cohesion, to share new information. Stewards have regular contacts with rank-and-file constituents, and to close the feedback loop between members, rank-and-file leaders, and union staff. We built an online bulletin board where any member or leader can share views, ask questions, or raise concerns, which helps to anchor a sense of community among members, worker leaders, and the union. When members feel engaged, they offer perspectives to help build strategy. The union's part is to listen, to offer recommendations, ideas based on their experience, but ultimately to be scrupulous around the process of inclusion. Also of key importance is in sustaining a campaign for as long as our members have done so is a galvanizing issue. For our members, that issue centered on patient care and the crisis in mental health, which has as its core adequate staffing. When care providers are prevented from offering anything meaningful by the limits of the system, they respond with passion and fortitude. What we found was that a truly member-driven, bottom-up union, that passion can be forged into a powerful weapon of advocacy for both patients and providers. Now, let me give you a little taste of what I mean through this chronology and highlight of events of the last 4 years. In 2010, Kaiser's 2,500 mental health clinicians in California voted to join the National Union of Healthcare Workers in elections conducted by the NLRB. The clinicians were psychologists, licensed clinical social workers, licensed marriage and family therapists. In 2011, during negotiations between the mental health clinicians and Kaiser's officials refused to discuss the crisis in mental health. In response, NUHW surveys clinicians across California to gather details about the problem, prepares a 35-page report on these issues called Care Delayed, Care Denied, and presents it to Kaiser. Despite the survey and the report, Kaiser officials continue to refuse to discuss the problems. In November of 2011, NUHW files a complaint with the California Department of Managed Healthcare, the DMHC, which is the state regulator in California, alleging Kaiser's violations of timely access regulations and other laws. By March of 2013, the DMHC publicly releases its final report, which cites Kaiser for multiple, quote, serious and systemic, unquote, violations of California's timely access regulations. In June of 2013, the DMHC announces a $4 million fine against Kaiser for its mental health violations. This is the second largest fine in the DMHC's history. Kaiser attempts to appeal this fine while at the same time retaliating against workers, prompting NUHW to submit a whistleblower retaliation complaint with the California Attorney General. In September of 2013, NUHW files a lawsuit to compel California's benefit exchange, California Covered, essentially asserting that the exchange has broken its own rules by allowing an HMO to participate that is not in good standing. In the same month, NUHW finds evidence of conflict of interest by DMHC's lead investigator, who had abruptly resigned to work for Kaiser in their regulatory response unit. NUHW files a complaint with the California Fair Political Practices Commission. Meanwhile, NUHW discovers other unsettling conflicts of interest among members of Kaiser's board of directors, resulting in 2 resignations. In the months that followed, the state initiated its follow-up survey of Kaiser, and 3 class action lawsuits are filed by patients in addition to a second whistleblower complaint. In September of 2014, that number grew to 4 class action lawsuits by patients, and Kaiser had dropped its appeal of the $4 million fine rather than endure a public hearing. By this time, local, state, and federal elected officials are starting to take notice. Notably, a listening session is held in Santa Rosa, California, to hear the public's opinion on mental health care. An overflow crowd of 150 to 200 mental health consumers, family members, and public attended the forum. 90% of the speakers are Kaiser patients, and virtually all of them sharply criticized Kaiser's services, with some speakers describing suicides and other tragedies affecting their loved ones. On the following day, Santa Rosa Press-Democrat publishes a front-page article entitled, "Kaiser Blasted at Mental Health Forum." Then, in January 2015, where I started my talk to you this morning, Kaiser's 2,600 therapists conduct a week-long statewide strike to protest Kaiser's failure to staff its mental health clinic. The strike brings unprecedented media attention to Kaiser's mental health services, including more than 700 print articles and 500 radio and television stories. The strike is followed in February of this year by results of the DMHC follow-up survey, which includes 33 pages of details outlining continued serious and significant violations, and refers to the survey to its enforcement division for further investigation of possible disciplinary action. To date, we continue to see Kaiser retaliating against our whistleblower leaders, prompting more media and attention to the problems. In 2013, Dr. Alex Wang, a psychologist at Kaiser's Fremont, Clem, and an early whistleblower to the state, noted in a patient's chart that the patient should be seen sooner, after discovering the patient would wait more than 3 weeks for a first-time appointment, which is a violation of state law. Kaiser disciplined Wang, claiming his clinical note was political speech, and for the next 2 years targeted him for a series of performance reviews that questioned his clinical judgment in advocating for more timely appointments for his patients. Last month, Kaiser fired Dr. Wang, prompting an outpouring of protests from Kaiser mental health professionals, unprecedented media, and a formal complaint to the California Attorney General's office by NUHW. I could go on, but my point is this. We've had an exemplary campaign which exploits the vulnerabilities of the industry using the environment of regulation, the interests of the public, and the unified voice of the worker as its primary strategic tactics of leverage. In doing so, we've maintained a note of vigilance that has proven difficult for the employer to avoid, dilute, or deny. We believe that this continued pressure is unsustainable for Kaiser. In our most recent negotiations with Kaiser, and because of our actions, they've agreed to hire 500 new clinicians throughout the state. We also believe that, like the VA, Kaiser is large enough that changes in service delivery there could result in a general raising of the floor for these services throughout the industry, thereby effectively changing access to mental health services that are so desperately needed by all of our communities. Seen in this light, the union is not only a tool for the interests of a particular group of workers, but lends its advocacy heft to broader changes in our community as a whole. By building a network of like-minded clinicians and constantly going back to the base, NUHW has maintained its core values and stayed connected to what is truly meaningful to these clinicians. In this way, the union has helped these professionals galvanize their voice into activism that stands out in the labor community as a direction which healthcare workers need now more than ever. Thanks for your attention.
For those of you who just came in, we've been listening to Clem Papazian, who's from the NUHW in Northern California, in Oakland. And I would just add that I think everyone would agree that it can be quite unsettling to listen to stories about suicide. has happened in the run-up to this movement, and it's unsettling as well to be on a picket line where one of the slogans is "No more suicides." And so the only thought on a really marvelous manifestation of the values of these people, the only thought was, well, where were the other unions? What are they saying here? Now, our next speaker, and I wanted to say this to the newcomers, our next speaker is very generously giving us her time this morning. She's Judy Sheridan Gonzalez, and she's the elected president of the New York State Nurses Association. She's a working registered nurse.
Everyone, in a collective environment where you're really shoulder to shoulder with other people, so it's easy to kind of organize in that level. What are the challenges in the metropolitan areas, in the cities that are well organized? Nurses' salaries have skyrocketed because of union organizing, and their level of consciousness in some ways has been somewhat altered because they're doing well. Even though the industry is repressive, some of them are making a lot of money, and then with this with the 12-hour shift, some of them have 2 jobs. I don't know how people work 2 and 3 jobs, but they do. We have a very diverse population. It's always has challenges when you have a diverse population in age and geography and ethnicity and race, and bringing people together is always very challenging in that environment. Our education as nurses is to be passive, complacent, follow doctor's orders. That's a challenge. The issue of professionalism, being a profession, particularly the unions, the structures that organize nurses throughout the country, historically were these professional nurses associations who opportunistically jumped on a collective bargaining bandwagon to keep members. But they were professional associations run by a board very often that consisted of managers and educators, not staff nurses. And there's an elite situation with professionals that kind of ran away from unions. I think that's really changed in the last 10 years. And the structure of the organizations made it very difficult to organize. So the way we took over NYSNA was not the way I'd recommend you kind of do things, even though it worked. Because we did end up kind of really pushing to take over the board, have electoral strategy before we had our caucus well developed. We had years and years of caucuses. I even brought some pictures I found from 30 years ago with the same slogans. But the caucuses were never able to be developed because the boards were controlled and the structure of the organization was such that you couldn't really run the union. So we knew we had to take over the board to change the structure, and then we felt we could develop our rank and file better. Those of us who did take over the board did have rank and file support in our facilities. Remember, this structure of our organization consisted of 153 separate collective bargaining agreements. That was, for those of you, it's very, very challenging to organize anybody when you have 153. We also had staff that was not bought in, didn't buy in. Most of the staff were nurses who either got, had marginal records or wanted to get out of being a nurse, no commitment to the organization at all. And the leadership was a real problem. So how do we get elected? We decided to run a slate of candidates around a set of principles after we had been, some of the activists had been co-opted and attacked and marginalized, and I can't even get into that, that's another book. But so what we did was our opposition consisted of a kind of union section of the organization that was in control that was incredibly corrupt, a leadership that was all about not being a staff nurse and this elite kind of professional model that was anti-union, and us. So there was a 3-way vote. The vote got split, and we got the like 51, 48%. We got the vote. That's how we took over a majority of the board. But also, it followed a pension and benefits crisis that the nurses were very upset about. So that it was like a perfect storm. But it was amazing, and then of course it was shocking to everyone. So our group that got elected wasn't seated. They tried to get around seating us for several months, which was another challenge, which organized members against the former leadership and helped us to develop enough militancy to have a convention where we changed our bylaws. So we were able to really build a union, and that's what we started doing about 3.5, 4 years ago. What have we done since then? We have a bunch of rank and file structures. We've trained about 700 stewards. We've never had stewards before, and we're developing advanced steward training. We did model ourselves around CNA structures, NNU, Massachusetts, NUHW. We had a lot of great role models that taught us a lot of things. We expanded our board, we regionalized our board, we learned things, the upstate areas, the diversity issue is really intense. The upstate areas are really depressed. They're not unionized as well, but they're also provincial, I guess. They're a very different culture, and there's a lot to get through to bring these forces together. So what are we doing now? Obviously, we have these big contracts. We are facing all these mergers and acquisitions, and we thought it would be a really good idea to try to have some kind of coordinated bargaining, and in fact, even multi-organizational bargaining. And we have 3 major medical centers. There used to be 4 that we have members in New York City. One of them is taken over, swallowed up the third. So we really have 3. It's Mount Sinai, Montefiore, and New York Presbyterian. New York Presbyterian now has the Koch brothers have a controlling interest in New York Presbyterian. I guess I'm in a place where everyone knows who the Koch brothers are. I have to explain it to some people. So there's a big thrust to destroy our union. We are seen as a force, a powerful force in the state, a powerful force in the city. We've fought hospital closings. We've kept hospitals alive for a period of time. Long Island College Hospital, Interfaith still alive. We've fought against marginalization of the public with a Certificate of Need program. Fought against privatization. We just had a big victory with privatization of dialysis services. And we're sort of seen as a force to be reckoned with. Everybody knows. And the hospitals refer to us as the bad union. When we negotiate with them, we're the bad union. What's happened? We were able to convince these 3 mega empires to negotiate with us as a group. We have several committees that the leadership of NYSNA locally very often was not people who were militant trade unionists. They were people who often use it as a stepping stone to get a management job, to be perfectly honest. So we have challenges with our leadership. But we've tried to transform ourselves. In my hospital where I've worked, the nurses, we're considered the union shop of the hospital. The nurses at my hospital, when you make rounds and there's a problem, they don't say, what's the union doing? They say, what are we going to do about it? They feel they own the union. It's powerful. When we were negotiating with these people, the Greater New York Hospital Association, they thought, the reason they did it is they probably thought they could crush us. They were smarter than us. That didn't happen. We're head-to-head with them, but we hadn't made much progress. So what did they decide to do? They started to employ repressive measures against us. So we do our steward training on site. We have this agreement that we can use classrooms. The first thing they did at my hospital was they tried to kick us out of the classrooms. We had a steward training set up, and they all of a sudden said, okay, no more classroom space. We're not going to give you space to organize. We said, oh, we're just teaching classes, at these places. I don't know what the problem is. So they canceled all of our rooms except one. I had a steward class in one of these rooms, and they didn't know that I had set it up. So I kind of thought there might be a problem the day of the class. So everyone shows up for the class. We get there, we start teaching, we have all this food, and then they say, oh, HR called, you have to get out. We said, well, let me call HR. I called HR. I said, we can't leave. I have all these people. I have all these eggs and bacon, and carry that out. So they said, well, you have to leave. Or, I said, listen, I can't tell these people to leave. This would be very bad. So he said, well, we're coming. We're gonna be there. I said, yeah, okay. So they came and they wanted to sit in on the class. We're just gonna, watch the class. So they came in and we said, wait a minute, we got to talk about this. And people said, I don't know what we're going to do. These are all new people. And we didn't want. And they said, we're going to call security. So we said, well, let's see what happens. So they came in, and I had to control myself to not say, this is how you make a Molotov cocktail. I just started teaching, and they got uncomfortable. And then one of them came in and looked like she was recording. So we said, what are you doing? We kicked her out, and then we locked the door. And then they were knocking on the door. We said, you can't come in. And then security came. So these are new people. So we said, well, we're going to march out with dignity. And we had a backup anyway in a community organization. But we all marched out and we videotaped. They're kicking us out of our hospital. So this group became transformed overnight. Like their first experience was this militant confrontation, and they were saying, "Can we get arrested?" "I'm willing to get arrested." "No, I'm not." So just an example of how you seize an opportunity. Because to get nurses to do a walk on the bus and do these things, it's not that easy, right? We're sweet little obeyers. So what happened? Then they tried to ban access to our union reps. And this is happening all over the hospitals. They did it to us. They wanted to take the IDs away of our reps. They didn't stop the local leaders. I work full time in the emergency room. in addition to being president of the local bargaining unit of 3,000 and the state, which is a problem. But anyway, they wanted to ban access to our reps. They wanted to take their IDs away because they said, in order to have access to the members, you have to alert the managers when you're coming, who you want to meet with, and they'll arrange a private space for a meeting. And we said that's totally impossible. We cannot do that. So what happened was when they said they can't enter the building anymore, we organized in 12 hours 60 nurses to swarm at the CEO's office. And the CEO was stupid enough to be downstairs. So we surrounded him and terrorized him. And they moved him upstairs. HR came down and took the brunt of the yelling of the nurses. And then it was so energized. There were police. They had all these police cars and cops. And we said, and when the cops were standing, they were looking like just watching us. And we said, you have access to your union, right? I know you do. That's all we want. And they were like looking down. And so then we weren't getting anywhere. So we said to HR, well, you going to arrest us? You going to arrest us? And he said, well, I'm not going to, I don't know. And so then we marched into the hospital, 60 of us, and we took over the cafeteria for like 20 minutes. We just took over the cafeteria. So that word got around, and the hospital kind of said, let me back off. They went to our sister site, and they decided to harass them there because our sister site on the other side of the Bronx had a more passive reputation. So they did the same thing, but they didn't have that level of organization at the moment. So my counterpart there, Kareem, decided to give out these buttons. We were going to give out these buttons for Nurses Week. Nurses Week is a big thing for nurses. These little cute things. I have some for you. They say, NYSNA, caring for all New Yorkers, underlining all about disparities. And we were going to give them out as little gifts for Nurses Week. So she went to the Nurses Week breakfast. They had been harassing them, so they knew her. So she put on a wig and glasses. This is true story. Went to the Nurses Week breakfast, and they said, oh, you have to leave. You can't stay here. She said, well, I'm a nurse. I have a red, I'm giving out these pins. It's caring for all New Yorkers. This is a nice thing. And they said, well, you have to leave. And then they got security to come. They said, they're going to arrest her. So 6 security. You can't get a security guard when people are shooting at you in the ER. But 6 security guards came to escort her out. So 7 or 8 nurses surrounded her, and they all marched out together. And then we had a press conference. Again, 80 nurses show up at the press conference. And the press conference was nurses try to talk about safe patient care threatened with arrest, right? And they got on all the TV stations, and now the politicians who are in these empires, remember these empires are big, they control the politicians, they give them money. But now they had no choice, they want to meet with us and talk about what's going on. This is in the context of the entire struggle that we're in. So we're trying to capture the minds of everybody, the hearts and minds of the public. We actually made progress in the state legislature. Our 2 big initiatives are safe staffing and single payer. Our single payer initiative did pass the assembly. That was a big deal. Not going to be a law, but it just shows they're kind of nervous, these politicians. They don't want to mess around with these people who are well respected. But we do have a lot of challenges. We're not getting anywhere in negotiations. We have some of the units, like mine, are very militant. Some of them are not. We're trying to bring everybody up to speed, using every kind of social media we can. But of course, this is really all about one-on-one conversations, which is why union access is such a big issue. Our members do understand that in many of our places now, because they manhandled one of the reps at another facility, and that's an ongoing struggle. So, we attack legal struggles. We've won arbitrations, lost arbitrations. Our members also, we try to have fun. They fired a nurse in the OR a year ago. They accused her of sleeping. She wasn't. We fought back. We weren't allowed to picket during the life of the contract, so we had a rally. And we have a phenomenon in the hospital where they admit people to hallways, right? Upstairs, on the units, in a stretcher, in a hallway. And it's a big deal. They deny it, but it's pervasive, and the ERs are overcrowded. So we linked that issue with the firing of this nurse and had a big rally in front of the hospital, and we had a cot. We put it out on the street with nurses dressed up in gowns, and we had a hard time convincing. We did a skit because we couldn't do a picket, couldn't hold signs. So since we couldn't hold signs, we had letters that nurses held that said, safe patient care and stuff like that. Not a sign, it's a letter. And then we couldn't get nurses to be we got a few nurses to be in the skit, and the Daily News came. And the skit was great. We had a lot of fun. And we were front page of the Bronx Daily News, you know, not quite ready for Broadway. And now everyone's saying, when is the next skit I want to try out? So, you know, we had fun. We have music. We have, anytime we do anything public, we have fun. We make sure that people feel really good about it, not just because they're scared, right? People are scared. It's scary to do things that are borderline. So we said, okay, we're not getting anywhere in negotiations. How do we engender this strike vote for the 9,000 nurses that we're negotiating in this big structure, and then another 9,000 in little facilities? So we had pickets, we had, you know, prep stuff, and we are basically pulling off a vote. In my facility, our bylaws state we have to get 2/3 of all the members, not just who votes, 2/3 of all the members to authorize a strike, which is half of so many per diems, people on vacation. It's really challenging. So we have achieved that in most of our facilities already. In my facility, we have a 97% yes vote for strike, and it's pretty similar in most of the other places. And that voting is going to end Monday or Tuesday. We're not going to necessarily hand in a 10-day notice immediately. We have to really assess our ability to sustain a strike, particularly because they're engaging these scabs right now with $75 an hour, 60-hour weeks, because overtime is about $6,000 a week plus transportation. I mean, this is extraordinary. Extraordinary. What we figure they're going to pay for breaking a strike in a week, we could probably settle a contract for. Our contract demands, what's providing us is not money, it's staffing, it's community rights, it's safe patient care, no overcrowding in the ERs, stopping the hallway admissions, things like this. So basically, you know, our next week it's this week already. I've lost complete count. We're already next week? Okay. So our media campaign, we have 4 negotiation sessions set up. It's going to be a game of chicken. We're not really sure where we're going to go, but we're really hoping to have enough pressure on the employer to avoid a strike. Strike is something that's really hard to pull off, it's particularly when we have all these different contracts. But certainly there's a lot of sentiment that if we have to go on strike, we will. What are our challenges? Sustaining involvement, you know. The question of the Community Labor Alliance, we've done a lot of that, but that's still an ongoing thing. How do you keep people ongoing involved? How do you develop leaders? How do you get youth involved? We're, you know, on that case, but the work, it's just old-fashioned, really hard work that we all have to do, that we all have to keep doing. And, you know, we plan to still do it. So one little cute thing, we have these, you know, we all had to get this flu shot. It was a mandatory flu shot that didn't work. So everybody had to wear these things that I got my shot, right? But the shot didn't work. So when we gave out these buttons, we said, oh, the flu shot was good for something. It's a good bulletin board for NYSNA buttons. And the way it says, it looks like I got my NYSNA to protect. So everybody's wearing, I got my NYSNA to protect. We also have these things, here's this. We have contract action teams. People, we have, in my hospital, we have 300 of them, people who are activists. And they wear a little contract action team, little cat button, they wear those. You know, everybody's wearing these things. At the Nurses Week celebration, which is a very sacred thing, and you're supposed to behave, several nurses got up and said, you know, I want to thank my mother and my father, and I want to thank my union, you know, and the managers were hysterical, and they're wearing these buttons. And I have literature here that you can collect later. But we're part of a bigger movement. We're not stopping. We have people now who are really excited. I had a nurse, when we organized for the strike vote, we had 200 volunteers helping us, giving their own time. I had one nurse says, well, I can give a half hour. And she went around with me from 7:30 to 8. At 10:30, she was like, are we leaving? We're not leaving, right? Like, I'm coming tomorrow. So that's what we're doing. That's it.
Thanks, Judy. Our last speaker, some of you missed the long introduction. You just get the short one, but another very heavy resume. And just say that Dana Simon has come down from Boston to be with us. He's the Director of Strategic Campaigns for the Massachusetts State Nurses Association.
All righty. Thank you. Thank you, everybody, for being here. And unlike Judy, I had only one parent in healthcare. My mom was a registered nurse at the Beth Israel Hospital in Boston. But like Judy, also, I had a family childbirth around union issues. My son, who's now 14, so this must have been about 14 and a quarter years ago, my old union, SEIU Local 250, that evolved into NUHW, was about to strike Summit Medical Center, where my wife and I were going to childbirth classes once a week. And the next childbirth class was going to be right on the strike day. I think it was a 1-day strike or a 3-day strike. So I made arrangements with the nearby Kaiser Hospital, which that week we weren't striking, to move the childbirth class. And I told the childbirth educator at Summit, and she put out an email to everybody. And some administrator from Summit calls me and says, you know, Mr. Simon, we just want to thank you. We are so appreciative. You know, this union, what they're doing is terrible. They gave us no notice whatsoever. And I said, well, I think they gave you 10 days notice. Right? There's this dead silence. So the topic is progressive healthcare unions. So the issue, what are some of the things that typify progressive healthcare unions? And Elizabeth, Clem, and Judy have already, in their presentations, emphasized the agency of the workers, that the worker is the union. Anything else is not a progressive healthcare union, and I would argue is not even a union. But what I want to emphasize in my short talk will be the idea that a progressive union is about issues that are broader than the narrow self-interests of its members. A healthcare union already has a leg up in that, you might argue, because the issues of the members, the nurses, the mental health workers, the everybody else, their very labor is making the ill well. So in that sense, we've got a leg up over the prison guards union. My apologies if there's any members of the prison guards union in the room. But at the same time, that's not necessarily the case. It's not, we don't get a pass by saying we're progressive by the very virtue of the work that we do, making sick people well. Well, not me, but our members making sick people well. Because we have to make choices as a union. So for instance, in Massachusetts, the Massachusetts Nurses Association, we're in bargaining all the time with many different employers. About 85% of the hospitals are unionized with the M&A in Massachusetts. We could prioritize wages and benefits over patient care issues. That would make it really easy to settle contracts, really easy. I've been through, well, everybody's been through rounds of bargaining where we had patient safety staffing limits on, say, we could talk about, we can say to the employer, go to hell. We don't pay for safe staffing, but we do. On the subject that it's not necessarily the case that because healthcare workers take care of the ill, we're necessarily a progressive healthcare union. Well, it's not the case because other unions sometimes make different choices. We were proud to pass a law that went into effect about 2 years ago that banned mandatory overtime in Massachusetts hospitals. But sadly, it banned mandatory overtime only for RNs. Just to give you a picture of that for anybody here who's not familiar with the issue and doesn't work with hospitals. In a hospital, very often, at the end of your shift, it might be an 8-hour shift, it might be a 10-hour shift. Very frequently, people work 12-hour shifts in hospitals. The hospitals, to save money, they have just-in-time staffing programs. They don't want to hire a single person more than they need to staff. And so there's nobody, and they'll just tell you, you can't go home. You can't go home no matter what. You can't go home. And for a registered nurse, it's patient abandonment. If you refuse that order to not go home, you not only get terminated, but they take away your license. They take away your ability to make a living anywhere. Your license could be revoked. I saw one particularly amazing example of this back working for Local 250 years ago, representing workers at the Santa Rita Jail who were employed by Prison Health Services, a for-profit healthcare corporation. We represented the place wall to wall, so mental health counselors, LVNs, nursing assistants, and also RNs. We had we had 2 members of the bargaining unit who were visited by Child Protective Services because they had been mandated, told you can't go home so frequently that they can't pick their kids up from daycare, and CPS got called on them. 2 people. In that place, it was even worse because if you refuse that direct order for Prison Health Services, they don't just fire you, they escort you with your hands behind your back with 2 prison guards. You could say it's it's militarized. Well, no, it's exactly militarized. It's a jail. So I want to talk about 2 particular issues that we're fighting for. And before I do, I just want to add a caveat. At the risk of making a controversial statement at the left forum, legislation and ballot initiatives are not intrinsically progressive. We are in the midst of 2 ballot initiative and legislative fights, but it's the issue that I would argue is progressive because it's about something much bigger than the narrow self-interests of our members. The first is a ballot initiative for safe patient staffing limits. A year ago, we won a law that limits the number of patients that a nurse can have in an intensive care unit to 1 in most circumstances and 2 in some circumstances. But the rest of the hospitals don't have any such law. Employers are competing with each other basically in a race to the bottom. Who can decrease their rates? Who can increase their profits by destaffing? Where many studies have shown, most studies have shown that a nurse can safely take care of 4 patients at the same time in a medical surgical unit. And there have been studies that show a percentage increase, a very significant percentage increase of morbidity and mortality every time you increase that by a factor of 1. It's something like I don't know the studies, it's something like a 15% increase in morbidity and mortality as you increase by 1. Well, some hospitals will staff at 1 to 7 at night, some will be 1 to 8. We did a picket about a year and a half ago where a nurse came up with a great picket sign, just an amazing picket sign. She said, "I can safely take care of 4 patients. You are number 7." So the principle behind that bill is several. This is an issue for the public. Arguably, it could cut into money that could otherwise be used for our wages. But in a union that's a union in the sense of what a union should be, that is exactly irrelevant. The second part of it is, though, also in a strategically forward-thinking union, I mean, what do unions do in their most basic level, be they progressive or not? You take wages out of competition in the market. You organize a whole market so no employer can compete with another employer and make more money based on the fact that they pay less than the other. Because if you organize the whole market, you take wages out of competition. We're attempting to do exactly that with staffing, taking mortality and morbidity out of the market for competition. So as where one hospital might argue that if you make us do that, you could kill us relative to that hospital over there, we got you covered. You know what? You made a good point. We're gonna make that happen to everybody at the same time. You make a good argument. Returning, however, to the issue that we have choices to make, I was mentioning for a reason, and I forgot the reason, the mandatory overtime ban in Massachusetts, and how sadly it covers only registered nurses. Well, the sad fact about it is, we have choices to make, right? We're not progressive just because we're a union or a healthcare union. The reason it only covers RNs is that the other large healthcare union in Massachusetts, an SEIU union, opposed the ban on mandatory overtime. And they were quite clear it would interfere with their relationship with the bosses. The bosses asked them to oppose it, and they needed to oppose it. We reached a compromise with them, which was, can you drop your opposition if it only covers RNs? We think it's messed up that it would only cover RNs. It makes no sense that it would only cover RNs. And ultimately they said, we can spin that to the employers. If you only include RNs in this, we can drop our opposition. We will not support it, but we'll drop our opposition. So there's decisions to be made about what you really believe in as a union. On the safe patient limits issue, I just want to read a couple of numbers from a recent survey that the M&A paid for. We paid for this survey, but it was done by an outside survey firm. It surveyed RNs from throughout the state. Interestingly, though, about 60% of the participants in the survey were non-M&A members, which means, given that we represent about 85% of the acute care hospitals, then a lot of these people must have been managers, right, in here. We just used the registered nurse registry from the state. People answering the question, do nurses lack the time to properly comfort and assist patients and families? Survey says 86% of the respondents throughout Massachusetts. Nurses lack time to educate patients and provide adequate discharge planning, 81%. Have you personally been aware of a mortality of a patient caused by short staffing? 25%. 25% say they are personally aware of a mortality, a death. Have you seen or witnessed injury or harm to a patient? Not mortality, but injury or harm, 50%. Have you seen readmission of a patient because of the inadequate care resulting from staffing? 56%. Have you seen medical errors such as improper medication or dosage? 61%. So that's that issue. That's filed as a ballot initiative, and oddly enough, under Massachusetts law, different from some states, you don't have to pick if an issue is going to be a ballot initiative or legislation. In Massachusetts, you have to do both simultaneously. So the ballot initiative goes forward with an identically worded piece of legislation that the idea is under the state constitution gives the legislature the opportunity to deal with it before it's too late. I think their deadline is like July 1st to act, or else it goes forward. Seems like a logical thing for a healthcare union to take this position, but again, the other healthcare union in the state, which also represents RNs to a much lesser degree, but it represents some, was opposed to this. They were opposed to it a couple of years ago and found it in their wisdom to simply not oppose it publicly this time around, but have been trashing it in private to legislators. The other piece of legislation in the only two that I want to describe, is a ballot initiative and legislation called the Hospital Transparency and Financial Fairness Act. This is about wealth redistribution in the hospitals. This huge disparity between the wealthy teaching hospitals and the very unwealthy community hospitals. We've seen 2 hospitals in the past year close in Massachusetts that were disproportionate share of Medicare and Medicaid. Medicare and Medicaid don't pay the bills. You don't break even on a Medicare or Medicaid patient in Massachusetts. assume it's the same in every other state. And so the hospitals with a very high percentage of patients who are just that are having a very hard time surviving, and 2 of them closed, one in North Adams, one in Quincy, Massachusetts last year. What this ballot initiative would do is 2 things. Number 1, CEO pay would be capped at 100 times the pay of the lowest paid employee at the hospital. Now, that sounds pretty reasonable. That even for a left forum audience sounds pretty wimpy, right? The Massachusetts Hospital Association is going insane over that. Insane, I tell you. Perhaps you could lend a hand clinically. But the initiative says, but it's not illegal to make more than 100 times more. After all, this is a capitalist country. If you do, however, choose to pay your CEO or CFO or COO more than 100 times the lowest paid, you may do so, but you must then put an equivalent sum in the form of a fine to the state. And that will go into a new fund that will be redistributed to Medicare and Medicaid disproportionate share hospitals. The second element of that legislation is any hospital with a profit margin of 8% or more, everything above 8% gets extracted from the hospital to go into the same fund that gets redistributed to hospitals that care for low-income people. The third element of it is financial disclosure. So the hospitals would have to disclose all their finance, including specifically offshore accounts. One of the things that is probably true in every state, but I know it's true in Massachusetts, because I know it's true in Massachusetts, all the hospitals keep very large sums of money in offshore accounts in the Cayman Islands. So, for instance, all their malpractice funds are in the Cayman Islands. Every single hospital, without exception. You can't see them. Well, the people of the Commonwealth of Massachusetts pay the majority of the money that goes into the revenue of these hospitals, or taxpayers. Yeah. These are polling very well with the public. And again, returning to the notion that ballot initiatives and legislative strategies are not intrinsically progressive. They're not. They're not. But the issue that we're bringing to the voters has the potential for being a great rallying cry around healthcare as a right, as opposed to healthcare as a privilege, and healthcare as a right as opposed to healthcare as a means by which for Wall Street corporations to profit. One of the largest now healthcare corporations in Massachusetts. Massachusetts has a many decades history of not permitting for-profits. Sadly, no more. There's a healthcare system called Steward Healthcare that owns now 12 hospitals. That's owned by Cerberus Capital out of New York. The chairman of their board is Dan Quayle, as in the George Bush Dan Quayle. The CEO, because of course he's not the CEO, because you wouldn't want to do that. The CEO is Jon Snow. For those of you who enjoyed Game of Thrones, it's not that Jon Snow, because then it would be excellent. It's Jon Snow, the Treasury Secretary under George Bush I. Is
former leader of the railroad, Conrail.
Really?
Yeah. Worked for him.
Did you? How was that?
Used to visit the shop. No, I never met him really, but he was there.
Yeah.
Yeah.
Well,
something else.
Those are the people they send to bargain.
He's retired from the railroad.
Uh-huh.
They gave him 40 years, even though he's only there for a few. What he needs more another job for, I don't know.
Right. Right. That was the one time in his life he didn't sing the evils of pensions. Well, I think that's it. In summary, these are some of the principles that I think we fight for as progressive unions. The one other, it's an odd story. I have this habit of talking about really salient things and always ending with something trite. They taught me to do that. Here's something trite, but it's a story. It's a story I love. Another element of a progressive union is we avoid preaching to the choir. This notion of taking these ballot initiatives to the whole people of the state and organizing them around things that you could see as very technical is what building a movement is. The movement has to be more than nurses and hospital workers. It has to be the whole public. A bizarre example of that is years ago, once again, working for the predecessor to NUHW. I was in Redding, California. Redding, for those who don't know, is a very conservative would be an understatement. George W. Bush was conservative. He would not get along in Redding. This is a pretty right-wing place. It was the day we settled the contract, and there's a moment after you settle the contract that the lawyers for one side retreat to their hotel room, and we retreated to our hotel room, and we divided up the remaining contract articles. It's all done but the shouting, and we're just going to type up the remaining articles. They got some to type up, we've got some to type up. I was doing the typing. And our bargaining committee was talking, and there was a guy I'll call Frank. He was an HVAC worker, you know, one of the guys on the roof of the building. I'll call him Frank because his name is Frank. And I was trying to not focus on what people were talking about. I was just trying to focus, let's get it done before anybody changes their mind. On management side, I'm typing, I'm trying to make the edits to find a printer, and I can't help listening to this conversation. Redding, as Cal will know, is part of their right-wingness. They've been, sadly, the working class has been organized to support the logging industry. And as you drive up through Mendocino and up through Redding, you'll see strung across the roads, wire across the roads with an earth firster hung in effigy from a noose as you're going up there. So Frank, I'm listening to Frank, and he said, you know, those earth firsters are so stupid. You have never seen more spotted owls around here than since they did the clear cuts. And I just couldn't, I had to get this contract done, but I just couldn't. And I closed my laptop with a nice loud click. And I said, brother, I just gotta say that is like the single stupidest thing I've ever heard anybody say in my life. And he turns around, like his face is red, but his face is always red. And he says, why? What? I said, because, brother, the poor little owls with their big owl eyes are just looking up at you from the pavement. They're just standing there. Of course you see them. The miracle on whatever street of that story was Frank didn't kick my ass. If not for unions and the ability to bring people together who are not the choir, and be able to develop trust among working people, we had absolute trust. We had, I don't know, absolute. It was, you know, a little touch and go for a second. But we had been through that struggle. He could hear from me, and some other issue, I could hear from him, something that it would be impossible for us to talk about otherwise, if not for the fact that we have been through struggle together. So, thank you.